What if the blood pressure number your doctor told you is fine, is actually killing you slowly? And what if the number they panicked about, the one that made them reach for the prescription pad, was completely normal for someone your age? I know that sounds contradictory, but after 22 years of treating blood pressure in adults over 60, the most dangerous thing about blood pressure is not the number itself. It is that most people, and honestly, many doctors are reading it wrong. Here's a number that should genuinely alarm you. The American Heart Association reports that nearly half of all American adults have high blood pressure. Among adults over 60, that number jumps to more than 70%. 7 out of 10 people your age walking around with blood pressure classified as elevated or high. But here's what nobody talks about. The Framingham Heart Study, one of the longest-running cardiovascular studies in history, found that heart attack and stroke risk does not begin at some magic cutoff. It rises gradually, continuously, starting well below numbers most people consider dangerous. The question is not simply, is my blood pressure too high? The real question, the one that actually determines whether you suffer a heart attack or a stroke or lose your independence, is too high for whom? Too high under what circumstances, and too high compared to what? That is exactly what I'm going to answer today. And by the end of this video, you will understand your blood pressure better than most doctors have ever explained it to you. My name is Dr. John Myers. I am an internal medicine specialist, and I have spent more than 2 decades focused almost entirely on one thing: the blood pressure of adults over 60. I have sat across from thousands of patients confused, frightened, frustrated, told by one doctor their numbers were fine, and by another they needed more medication. Patients over-medicated and dizzy, patients under-medicated and heading toward a stroke without knowing it. The confusion is not their fault. Guidelines have changed multiple times. Numbers considered safe 20 years ago are now considered dangerous. And the way most people measure blood pressure at home gives them readings that are completely unreliable. Today, I'm going to clear all of that up. I will show you exactly which numbers are too high after 60 based on the largest clinical trials ever conducted, including the SPRINT trial that changed everything about blood pressure treatment in older adults. I will reveal a hidden number most doctors never mention. One you can calculate yourself in 5 seconds that predicts heart attack and stroke risk more accurately than either the top or bottom number alone. And I will expose the measurement mistakes causing millions of Americans to get false readings, leading to unnecessary medication or dangerous false reassurance. Before we begin, this channel is brand new. I built it to give you information that takes most patients 3 or 4 specialist visits to hear. We are working toward our first 1,000 subscribers, and everyone matters. If what I share today helps you, subscribe right now. 2 seconds, no cost. It helps YouTube show this to more people who need it. Hit subscribe and look. Everything we're about to go through today with your blood pressure, the real danger zones, that hidden third number, when a high reading is an emergency, and when it isn't, that is exactly the kind of thing my patients ask me about every single day. So I took everything I tell my own patients and put it into one simple plan for living longer, stronger, and healthier after 60. 28 of the things that actually change as you get older. Your blood pressure, your blood sugar, your memory, your balance, and those are only some of them. Thousands of people are already using it to take back their health. It's already helped so many of them live their best life after 60. The link is on your screen right now, so go check it out at drmyers.com. And I'll drop that same link down in the description below, so it's right there whenever you're ready. All right, your 2 numbers explained. Start with something most people get wrong from the very beginning. Your blood pressure reading has 2 numbers. Most people only pay attention to one of them. That is the first mistake. And it is a mistake I have seen lead to outcomes that could have been completely prevented. Let me explain what these 2 numbers actually mean, because until you understand this, nothing else about blood pressure will make sense. The top number is called systolic pressure. This is the force your blood pushes against artery walls when your heart beats, when it squeezes. Think of it like a wave crashing against a seawall. Every single heartbeat that wave hits. The bottom number is called diastolic pressure. This is the pressure in your arteries between heartbeats when your heart relaxes. Think of it as the tide level when waves pull back, the constant background pressure your blood vessels live with every second of every day. Both numbers matter, but after 60, they do not matter equally. And understanding why is one of the most important things I can teach you today. As you age, your why aging changes. Everything arteries naturally stiffen. They lose elasticity. They become less flexible. When arteries are stiff, the wave from each heartbeat hits harder because the artery cannot expand to absorb the impact. That is why systolic pressure, the top number, tends to rise with age. It is not always disease. Sometimes it is simply the physics of aging blood vessels. But the bottom number often does the opposite. As arteries stiffen, they do not recoil as well between beats, so diastolic pressure often stays the same or actually drops after 60. This creates a pattern extremely common in adults over 60 that most people have never had explained to them. It is called isolated systolic hypertension. Top number elevated, bottom number normal, or even low. And this is the single most common form of high blood pressure in older adults. Now here is where the confusion gets dangerous. For decades, doctors were taught a simple rule. Normal systolic pressure equals 100 plus your age. So a 70-year-old with a reading of 170 was considered perfectly acceptable. That rule was wrong, and it cost lives. We now know from massive clinical trials that sustained systolic pressure of 170 in a 70-year-old dramatically increases risk of stroke, heart failure, kidney damage, and cognitive decline. That old formula gave millions of people false reassurance, while their organs were being silently damaged year after year. But the correction went too far in the other direction. In 2017, the American College of Cardiology lowered the definition of high blood pressure to 130/80. Overnight, millions of previously normal adults were reclassified as hypertensive. Many were over 60. Many felt perfectly fine. Many were started on medications they may not have needed. So what is genuinely too high after 60? The most important study answering this question. The trial that changed the rules is the SPRINT trial, published in the New England Journal of Medicine in 2015. Over 9,300 participants, the largest and most rigorous blood pressure treatment trial ever conducted. SPRINT found that targeting systolic pressure below 120 reduced heart attack, stroke, and cardiovascular death by 25% compared to the traditional target of below 140. And in adults over 75 specifically, the benefit was even more dramatic, a 33% reduction in cardiovascular events. But, and this is absolutely critical, aggressive treatment came with real risks, more fainting, more electrolyte imbalances, more kidney complications, more falls. In older adults, a fall caused by overly aggressive blood pressure medication can be just as life-threatening as the blood pressure itself, which means there is no single number that is too high for everyone. The right target depends on your age, your health, your risk factors, your history, and your body. But I can give you the specific ranges that the research supports, and when I lay them out clearly in the next section and then reveal the hidden third number that most doctors never calculate or mention, you are going to wonder why nobody told you about it sooner. Here, the real danger zone numbers are the numbers based on the SPRINT trial, American Heart Association guidelines, and 22 years of clinical experience treating blood pressure in older adults. For adults 60 to 75, systolic below 130 at rest is ideal. 130 to 139 is acceptable if you feel well. 140 to 149 needs monitoring and lifestyle changes, and 150 or above consistently at rest. That is too high. That needs action. For adults over 75, below 140 is the general goal. 140 to 149 depends on how you feel and your fall risk. 150 or above consistently. Too high regardless of age. Diastolic below 80 is ideal. 80 to 89 needs watching. 90 or above consistently puts damaging strain on arteries and organs. Now the hidden third number. Number I promised you, a third number you can calculate from any reading in 5 seconds. Research shows it predicts heart attack and stroke more accurately than either number alone, especially after 60. It is called pulse pressure. Pulse pressure is the difference between your top and bottom numbers. Reading of 150 over 70, pulse pressure is 80. Reading of 130 over 80, pulse pressure is 50. Why does this matter so much? Because pulse pressure directly measures arterial stiffness. Stiffer arteries push systolic higher and let diastolic drop lower. The gap widens. And that widening gap is one of the clearest cardiovascular danger signals in older adults. A landmark study in the journal Hypertension, using Framingham Heart Study data, found pulse pressure was a stronger predictor of cardiovascular events than either systolic or diastolic alone in adults over 60. Stronger than either number by itself. Below 40 is normal. 40 to 60 is acceptable, but worth monitoring. Above 60, warning sign of significant arterial stiffness and elevated cardiovascular risk. If your reading is 160 over 70, most people focus on the 160, but pulse pressure is 90. That is a screaming alarm that your arteries have lost critical flexibility and your heart is working dangerously hard. Now, something almost no doctor discusses with patients over 60, something just as dangerous as pressure being too high, diastolic pressure, that when the bottom number is too low is too low. In older adults, diastolic below 60 is genuinely dangerous. A study in the Journal of the American College of Cardiology found that adults over 60 with diastolic consistently below 60 had significantly increased risk of heart attack because pressure between heartbeats was too low to supply the heart muscle adequately. I had a patient I will call Walter, 74 years old, retired mechanic from Tennessee on 3 blood pressure medications. Systolic controlled at 128, but diastolic had dropped to 52. Dizzy every time he stood up, fallen twice in 1 month. Walter was not having strokes. He was over-medicated. Diastolic pushed so low his heart was not receiving adequate blood between beats. We reduced one medication carefully. Within 3 weeks, diastolic rose to 68. Dizziness stopped. Falls stopped. Blood pressure remained controlled. His doctor was so focused on the top number, nobody noticed the bottom went dangerously low. Do not just watch the top number. Do not just watch the bottom. Calculate the gap and make sure the bottom has not dropped below 60. Too low can be just as deadly as too high. I want to ask you directly, do you know your blood pressure right now? Not from months ago, right now. Have you ever calculated your pulse pressure? Go to the comments and tell me. I read every single comment on this channel. Next, I am going to show you the measurement mistakes giving millions of Americans completely wrong readings. Wrong readings leading to wrong treatment and the correct way to measure that most people have never been taught. Before I show you the correct way to measure, let me show you how most people. 5 mistakes that fake your reading get it wrong. These are not minor mistakes. They can add 10, 20, even 30 points to your reading. Those false points are the difference between going home reassured and leaving with a prescription you do not need. Mistake number 1, measuring without resting first. You walk into the doctor's office, check in, walk down a hallway, sit on the exam table. Within 60 seconds, the nurse takes your reading. That reading is almost certainly wrong. A study in hypertension found blood pressure taken without a 5-minute rest was 10 to 15 points higher systolic than after proper rest. That is the difference between 138 and 148, between acceptable and too high. Mistake number 2, talking during the reading. Research in blood pressure monitoring found talking during measurement raised systolic by 10 to 15 points. The nurse asks how you are feeling. You answer reading jumps. Nobody connects the two. Mistake number 3, crossing your legs. Same journal found crossing legs raised systolic 5 to 8 points. Stack that and no rest and talking. You are 25 to 35 points above your true pressure. Completely different diagnosis from a completely wrong reading. Mistake number 4, wrong arm or wrong cuff size. Blood pressure often differs between arms by 5 to 10 points. Always measuring one arm gives a skewed picture. A cuff too small for your arm inflates readings artificially, almost never checked. Mistake number 5, white coat hypertension. Blood pressure rising in a medical setting due to anxiety you may not consciously feel. Your body reacts automatically. Heart rate increases, adrenaline releases, pressure spikes. A meta-analysis in hypertension found white coat hypertension affected 15 to 30% of diagnosed adults. Up to 1 in 3 people treated for hypertension may not actually have it. Pressure only high when someone in a white coat measures it. This is why home measurement matters, how to measure it. Right at home, and why doing it correctly is essential. Here's the protocol I give every patient over 60. Sit quietly 5 full minutes. Feet flat on the floor, back supported, arm at heart level, bladder empty, no talking, no phone, no television. Take 2 readings 1 minute apart. Use the lower number, write it down, twice daily, once within 20 minutes of waking before coffee or breakfast, once before bed, alternate arms every other day, 7 consecutive days, 28 readings, average all of them. That average is your true resting blood pressure, not a single office reading, not a number after rushing across a parking lot. Your actual baseline. If that average is consistently above 150 systolic or 90 diastolic, too high, needs attention. If 130 to 149, bring those 28 numbers to your doctor. They are worth more than any single exam room reading. Now I have given you the numbers, the hidden pulse pressure, the measurement protocol. But one more critical topic before this video ends. The question I hear most from patients over 60, when does high spike or emergency? Know the difference blood pressure become an emergency? When should you call 911 versus monitoring at home? What warning signs turn a high reading from something to watch into something that could kill you within hours? That is next, and knowing this difference could save your life. Here's what most people do not understand about blood pressure emergencies. A high number by itself, even a very high number, is not automatically an emergency. I know that sounds wrong, but let me explain. You check your blood pressure at home and see 170 over 95. Your first instinct is to panic, call 911, rush to the ER. In some cases, that instinct is correct, but in many cases, that is a temporary spike from stress, pain, caffeine, or anxiety about the reading itself. So how do you tell the difference between a spike and an emergency? The answer is symptoms. A high number without symptoms is a signal to monitor. A high number with symptoms is a signal to act immediately. Here are the symptoms that turn a high reading into a medical emergency. If blood pressure is above 180 systolic or above 120 diastolic, and you experience any of these, call 911 immediately. Severe sudden headache, unlike anything you have felt before. Chest pain or tightness, new or worsening shortness of breath, vision changes, blurring or partial loss, difficulty speaking or sudden confusion, numbness or weakness on one side of your body. These indicate hypertensive crisis, blood pressure actively damaging organs in real time, brain, heart, kidneys, eyes. A study in Circulation found that hypertensive crisis carried a mortality risk of up to 25% within the first year if not treated promptly, 1 in 4. But here's the other side. If your reading is 170 over 95 and you feel completely fine, no headache, no chest pain, no vision changes, That is not an emergency. That is an urgency. There is a medical difference. Sit down, rest 5 minutes, breathe slowly, retake your reading. In most cases, the number drops 15 to 25 points within 10 minutes. If it stays elevated after rest, contact your doctor that day or the next morning. I had a patient I will call Dorothy, 68 years old, retired school secretary from Ohio. She called my office in a panic. Home monitor read 182/98. Already putting shoes on to drive to the ER. I asked 3 questions. Headache? No. Chest pain? No. Vision changes? No. I told her to sit down. Feet up, eyes closed, breathe slowly for 10 minutes. Retake. She called back 12 minutes later. Reading was 148/84. Still. Elevated but no longer crisis range. The first reading came immediately after an argument with her sister on the phone. Body flooded with adrenaline. Her true blood pressure was never 182. Her reactive blood pressure was 182. Dorothy did not need an ER. She needed 10 minutes and a deep breath. This is the critical lesson. We do not treat single spikes. We treat patterns. One high reading is a data point. 2 weeks of high readings is a pattern. Know the difference, but also know when to act. Number above 180/120 with any of those symptoms. Do not wait. Do not rest and recheck. Call 911. That is a genuine emergency, and minutes matter. Understanding this difference, spike versus crisis, is one of the most important things you can learn about blood pressure. Most people never learn it until they are already in the ER being told they overreacted, or worse, being told they waited too long. Let me bring it all together. Bring everything together. I want you to leave this video not with confusion, but with clarity, not with fear, but with control over your own health. Here is what you now know that most people your age do not. Your blood pressure has 2 numbers: top systolic force when your heart beats, bottom, diastolic, pressure between beats. After 60, the top matters most because arterial stiffness pushes it higher. But if the bottom drops below 60, that is a danger sign most doctors miss. Now you know to watch for it. You know the ranges. Adults 60 to 75, systolic below 130 at rest is ideal. 130 to 139 acceptable. 140 to 149 needs monitoring. 150 or above consistently too high. Over 75 below 140 is the goal. 150 plus consistently too high regardless. Diastolic 90 or above consistently too high at any age. Pulse pressure, the hidden third number most doctors never calculate. Systolic minus diastolic. Below 40 normal, above 60 is a warning of significant arterial stiffness and elevated cardiovascular risk. You can calculate it in 5 seconds from any reading. Blood pressure moves throughout the day, rises with stress, movement, pain, caffeine, falls with rest, and calm breathing. A single high reading is not a diagnosis. A consistent pattern is we treat patterns, not spikes. That distinction alone could save you from years of unnecessary medication. The 5 measurement mistakes that falsely inflate readings by 25 to 35 points. No rest before measuring, talking during the reading, crossing legs, wrong arm or cuff size, and white coat hypertension affecting up to 1 in 3 diagnosed adults. You know the correct protocol. 5 minutes quiet rest, feet flat, back supported, arm at heart level, 2 readings 1 minute apart, twice daily for 7 consecutive days. Average those 28 readings. That is your true resting baseline worth more than any single office reading. And you know the difference between a spike and an emergency. High number without symptoms, rest, monitor, recheck. Above 180/120 with severe headache, chest pain, vision changes, or one-sided weakness. Call 911 immediately. Hypertensive crisis. Minutes matter. In 22 years of practice, the biggest problem is not pressure too high. It is patients who do not understand their numbers, patients afraid of readings they cannot interpret, patients over-medicated from false office readings, patients under-medicated because true pressure was never measured properly. Understanding your numbers does not create fear. It creates power, power to ask the right questions, measure correctly, know when to act and when to breathe. What is your blood pressure today? What is your pulse pressure? Take your reading tonight using the protocol I taught you. Calculate the gap. Go to the comments and share your numbers. I read every single comment, and if you have questions, I will help. If this video gave you real clarity, do 3 things. Subscribe right now. We are building toward 1,000 subscribers, and every one of you matters. Hit the like button. Tells YouTube to show this to more people who need it, and share this with one person over 60 who worries about their blood pressure numbers. You might give them understanding that changes everything. And if you want everything I tell my own patients about protecting your heart and the rest of your body as the years add up all in one simple place, it's in that same plan at drmyers.com, and the link is waiting in the description. Blood pressure is not a mystery. It is not a sentence. It is a signal. Now you know how to read it. I am Dr. John Myers. Take care of your heart because everything else depends on it. This video is for educational purposes only and does not constitute medical advice. Consult your physician before making changes to your medications or health routine.